Hello, and welcome back to A Doctor's Diary, practical medicine for everyday life. Today we are talking about botulism, a rare but extremely dangerous neurological condition that every clinician should recognize early because delayed treatment can be fatal. In this video, we will cover what causes botulism, the different types, the key symptoms you must recognize, how diagnosis is made, and the essentials of treatment. Botulism is caused by botulinum neurotoxin, one of the most potent toxins known in medicine. This toxin is produced by bacteria from the Clostridium group, especially Clostridium botulinum, and less commonly Clostridium baradii, Clostridium butyricum, and Clostridium argentinense. These bacteria form spores that are found everywhere in nature, especially in soil and sediments, and they may contaminate food. The toxin blocks the release of acetylcholine at the neuromuscular junction, which leads to flaccid paralysis. There are several forms of botulism, each with a different mechanism. The most common form is foodborne botulism. This occurs after ingestion of toxin-contaminated food, especially home-canned vegetables, preserved meats, or fish products. The toxin itself is heat-sensitive and can be destroyed at temperatures above 80 to 85 degrees Celsius, but the spores can survive if sterilization is inadequate. Another form is wound botulism, which occurs when spores enter a deep wound and produce toxin under anaerobic conditions. This form is most often associated with injection drug use or contaminated wounds, and the incubation period is usually between 4 and 14 days. Infant botulism occurs in children under 1 year of age because their intestinal flora is not fully developed. A typical risk factor is honey ingestion, which may contain spores. These infants may present with constipation, feeding difficulties, and generalized weakness. Inhalation botulism is extremely rare in natural conditions and is usually associated with laboratory accidents or intentional toxin release, which makes it relevant in the context of bioterrorism preparedness. Clinically, botulism presents as an afebrile, symmetrical, descending flaccid paralysis. Symptoms usually begin in the head and involve the cranial nerves. The classic early signs are known as the 4 Ds: diplopia, dysphagia, dysphonia, and dysarthria. Other early symptoms include dry mouth, blurred vision, photophobia, and dilated pupils. As the disease progresses, paralysis of the eye muscles becomes more evident, facial weakness appears, swallowing becomes impaired, and the cough reflex may be lost. Eventually, respiratory muscle paralysis develops, which is the main cause of death if untreated. An important clinical feature is that consciousness is usually preserved because the toxin does not cross the blood-brain barrier. Diagnosis begins with clinical suspicion. Important clues include multiple patients presenting with similar symptoms, a shared meal history, or characteristic neurological findings. Laboratory confirmation is achieved by detecting the toxin in serum, stool, wound material, or suspected food samples. Timing is critical because toxin levels in the blood decrease after 24 to 48 hours, so serum samples should be obtained as early as possible. Treatment of botulism is a medical emergency. Even patients with mild symptoms should be hospitalized and closely monitored, often in an intensive care setting. The most important therapy is the administration of botulism antitoxin. This should be given as early as possible, even before laboratory confirmation if clinical suspicion is high. The antitoxin prevents further toxin activity, but cannot reverse nerve damage that has already occurred. Respiratory support is frequently required, and mechanical ventilation may be necessary for days, weeks, or even months. Early airway management is essential to prevent respiratory failure. Antibiotics are indicated only in cases of wound botulism, typically using penicillin, and they are usually combined with surgical wound debridement. Prevention remains extremely important, as there is currently no widely used vaccine available for routine prevention. Safe food preparation practices are essential. Food should be properly sterilized, and reheated meals should reach temperatures above 85 degrees Celsius. Honey should never be given to infants under 1 year of age. It is also important to remember that freezing does not destroy bacterial spores. In summary, botulism is a rare but life-threatening condition that causes descending flaccid paralysis. The classical signs include diplopia, dysphagia, dysphonia, and dysarthria. Respiratory failure remains the main cause of death, and early administration of antitoxin significantly improves outcomes. Recognition of early symptoms and rapid initiation of treatment are critical for patient survival. Botulism may be uncommon, but when it occurs, rapid recognition and immediate management are essential. Early diagnosis, early antitoxin therapy, and proper respiratory support can make the difference between recovery and fatal outcome. If you found this video useful, consider subscribing to A Doctor's Diary, where we break down complex medical topics into clear, practical knowledge for everyday clinical practice. See you in the next episode.